Good morning. I am Dr. AKGupta, founder director AKGsOVIHAMS Medical Centre and a senior homeopathic consultant. Today we will talk on kidney disease and homeopathy. As you know, kidney diseases are increasing rapidly in today's scenario. It becomes all the more important for us to see that what causes the kidney disease and what are the precautions which we can take about it and what homeopathy has to offer in the kidney diseases. As you all know, kidney is one organ of the body. The God has given us two kidneys basically to flush out the waste products in the form of urine. And as and when there is a problem in kidney, the excretion of these waste products gets affected. It starts filtering in an improper manner and leading those waste materials to get merged with the blood and leading into the problems of kidney damage. They are primarily of two types, which is one is called acute, the another is called chronic. One is called ARF, the second is CKD, or we can say where we have got a chronic renal failure also. The basic problems, why the kidney patients they get to know, because usually it remains a silent and it starts showing its effects or the symptoms at a very later stage. And predominantly patients suffering from blood pressure, diabetes, they are more prone to get the kidney diseases. Apart from the normal patients which we come across and see in our routine practice of like kidney stones, hydronephrosis, strictures, or hematuria, blood in the urine, or the urine passes slow, or there's a burning, there's an infection, butane. These are the other common things which we see very often in our practices. But the serious diseases, when we call it the chronic kidney disease, it involves the total functioning of the kidney. Where the kidney gets affected, the filtration becomes affected, and patient land up into a problem of called uremic conditions. And usually, whenever we see a patient, when do we suspect that patient has got a kidney disease? Firstly, when a patient comes to us, he might show some signs of puffiness in the eyes. There is a frequency of urination, especially at night time, frequent urination, or there is a complete loss of urination, or there is a very slow urine which passes with a great difficulty. The patient may experience some burning or pain while passing urine, and there are times when the patient passes urine along with the blood, and there are sediments when the urine becomes very frothy or bloody, or there is a lot of smell. So these are the areas when a patient comes to us, we need to suspect and we look forward the patient might be having a kidney disease. And the another thing what we have to see and be careful about is when the patient, a known case of hypertension or a known case of diabetes, there he might be having continuously passing albumin with the urine, so which we need to keep getting it checked up. Now, how do we check up for this kidney disease? The first is we get a KFT done, then ultrasound done, then the urine report where we can see this urine test done, and in case extreme cases a biopsy can also be done in that cases. And otherwise, when we talk about the patients who come with the symptoms of kidney disease, it means the patient has already got affected by 80% of his kidneys has been affected, and then it becomes a really Herculean task to treat the patient and manage the patient from preventing the dialysis or even the renal transplant, as the patients, when they come to a homeopathic clinic, into our clinic, and we have seen number of patients at our AKGsOVIHAMS Medical Centres, that the patients come to us with a bunch of reports and saying that they've been advised to go in for renal transplant or dialysis. Now, can homeopathy do something about it? That is a time where we have to draw a line that what are our domain as in homeopathy, where we can say that yes, the patient can comfortably be treated off with homeopathy, or where we need to have the patient to be referred either for dialysis or for the hospitalization or under the care of a nephrologist. Like there have been a number of patients nowadays increasingly because they have been taking some kind of a medication on their own, like painkillers or antibiotics, and which is a very, very wrong practice, and continuous intake of those painkillers can cause a kidney damage. And later on when they find, then it becomes too late. Similarly, those patients, those who have been taking some kind of concoctions under the garb of some herbal medicines, where they are been given the feeling to increase their potency, strength, or for the joint pains, because they contains normally those heavy metals, which again are nephrotoxic in nature and cause a problem. So what happens in this case when the chronic kidney disease, the protein starts passing in the urine, and the blood level starts showing the serum creatinine level, blood urea nitrogen, as well as the urea. It keeps on increasing, and though the normal levels remain up to 1.1 is the serum creatinine and up to 40 is the urea. But we have seen in our clinics, number of times patient comes to us with the reports of serum creatinine has already gone up to 8, 9, 10, 11 even, and the urea from 80 to 200 plus. Another complicated case is where the uric acid is also high. The level is 6.2, or the patient coming with 8, 9 or 10 even. And then associated complaints are blood pressure or diabetes. Uncontrolled blood pressure, uncontrolled diabetes is a precursor for chronic kidney diseases. We call it in short, we call it the CKD. And when the waste products in the form of urine, it does not get passed, so it gets mixed up with the blood and starts circulating into the body, and it starts showing different kind of symptoms. Now, what are the precautions which I would like to advise the patients that of blood pressure or diabetes to control these two things essentially? Because if it remains uncontrolled diabetes, uncontrolled blood pressure, one is likely to get CKD or kidney disease as a complication. And sometimes they go hand in hand. The blood pressure can also be there because of the kidney problems, like you have a stone, you have a stricture, you have got a hydronephrosis, where the proper circulation does not take place because of filtration problem also. When it affects the filtration, as I said that blood pressure and kidney, they are quite interrelated, they go hand in hand. If the kidney is not functioning properly, it can cause the blood pressure or hypertension, or if the patient has got hypertension, it can lead to the kidney problem and damage also. Now, when the patient comes with us to us, he is usually having a puffed up face, as well as swollen legs, where we call it a pedal edema. When you have a lot of swelling on the legs, and if you try to press, there's pitting, there's a kind of a gadha in that, and which you can see that there's a water retention. And whereas water retention can occur because of some other things also, like in thyroid or in pregnancy and all that. Of course, we need to rule those things out. And once we have ruled those things out and seen the symptoms, then we can see that the patient is into the stage of kidney disease problem. And usually what we have to see, what has caused the problem is there's an imbalance in the calcium, there's anemia, there's a problem in phosphorus, there's a problem in sodium and electrolytes, all those things which we have to take into account and see that where lies the basic baseline problem. And it is again, unfortunately, it becomes very difficult for a patient to understand what to do and what not to do and what to take and what not to take, because the patient is anemic. There have been loss of protein in that, so you need to give them more protein. So if you give more protein, that causes a problem, and if you reduce salt and the potassium increases, that also causes a problem. So basically, this kidney disease, one has to be under a strict regime of diet as well as the proper management from the doctor's side, as well as the compliance from the patient side is very important. We in homeopathy are able to treat cases where the patients were advised to go in for dialysis straight away. We have been able to postpone those dialysis stage in many number of cases, and those patients, those who are already on dialysis, homeopathy has been able to help to reduce the quantum and the frequency of dialysis. Now, my advice to the patient, those who are having a kidney disease, to restrict in their diet also, which is very important, and that you have to take care of that, like juices and all that citrus fruits you need to avoid. You need to avoid taking very high amount of protein, but yes, it is needed for the body. Calcium has to be supplemented. Salt, if it goes down, then it causes a problem. If salt goes high, then also it causes a problem. So we need to go in basically conjunction with the help of a dietitian. It is definitely advisable for kidney patients to have a consultation with a dietitian also, where he or she can be given an optimum amount of food and food products, what are to be taken and what are not to be taken, or if they are to be taken and how much quantity. Like when we, I tell my patients, आप मोटा मोटे तौर पे ये नहीं खाओ, which are like chocolates, meat, fish, or even dairy products or dark colas. They are the one things which need to be avoided. And smoking, certainly yes, it need to be avoided. और उसके साथ साथ the patient who have baseline problem along with that is diabetes and blood pressure. So that need to be corrected regularly with the proper medication and all that. And we have got very good results with homeopathy treating the acute renal failure as well as chronic renal failure. Though that it takes time, and it becomes very important for the patient. If they come to a homeopathic doctor at an initial stage, we can do much better and we can save them from going in for dialysis or going in for transplant, if which has been advised, because normally the patient comes to a homeopathic doctor at a very late stage after running around from here to there and finally from one doctor to the other doctor and one hospital to the other hospital, and after that they come to a homeopathic doctor. So it becomes difficult for a homeopathic physician also to treat that case in a very effective manner in a short duration of time. So this is my advice to the patient, that if the moment they find out they have a problem, for that the best would be to get themselves regularly check up. After the age of 40, you need to get yourself once properly examined and investigated for any of the problems. And if you find slightest of changes in your urine pattern and in your the other symptoms, like in kidney disease, you do come out with a certain symptoms of there's a loss of appetite, nausea, vomiting, and itching. Persistent itching would be because of high protein going out there, or the phosphorus, the calcium, that causes intense itching. And the patient, here I would like to tell that patients, those who are already on dialysis, and they do suffer from this problem of itching, severe itching, and nausea, vomiting, or headache. We have got very good treatment in homeopathy, and we have been able to help our patients tremendously. So here it is a pointer for our colleagues in nephrology and other system of medicine also. Whenever they find the patients, despite of having dialysis, they do suffer from these problems where they find helpless. They can always take the help of homeopathic doctors, their homeopathic fellow colleagues, which can help wonders to give the treatment in the best possible manner, and the patient is going to feel much comfortable. Homeopathy has got a lot to offer in kidney disease, right from stones, stricture, hematuria, burning pain, or painful urination, or anuria or oliguria. They can be very easily tackled with homeopathy, and people already know that stones is homeopathy is a forte in its treating the renal stones. But apart from these common routine problems, significantly serious problems like renal failure and CKD also are treatable easily and comfortably, provided there is a compliance of treatment by the patient, as well as he or she is taking a regular therapy. And the another point is, which is important, that those patients who are on dialysis or who are being advised to go in for transplant, they can very well go in for homeopathic treatment, and can see that either they have been completely prevented from the dialysis or the transplantation, or at least it has been delayed to a greater extent with a good quality of life. With this particular message, I would wish that all those people who are suffering from CKD or kidney problems, they can try homeopathy and feel that their kidney problems can be taken care of, because kidney is the one organ of the body which would affect your heart also. So ultimately, we need to, as God has given us two kidneys for a function, there could be one non-functioning kidney which could be there for a long time, but the other kidney starts taking its workload and carries forward in a proper manner. So take care of your health, take care of your kidney, and as and when you have a problem, come to homeopathy. Thank you very much.